Okay. Welcome. Happy July 4th, Gobi Society. I'm so happy that everyone's coming on. We have something very, very exciting tonight. I am so exciting. Yay. Okay. We have Yoledet Academy. We have amazing nurses from Sternberg, Camp Sternberg coming on. But I just wanted, so you're going to come on. Hold on. Okay, okay. I see we have some people joined, but I am looking. Let's see. Just come on. So we have a very, very exciting, here we go. Okay. Awesome. Hello. How are you?
Hi. I can't. Oh, now I see you.
Okay. I'm so excited. I was just saying that we have some very, very exciting live going on tonight with Yoledet Academy. Hi, from Camp Sternberg.
Hi.
And,
I cannot see you yet, and Aviva is not sitting here yet because, of course, there's an emergency.
Of
because
course.
emergencies happen often in camp, but she'll be here shortly.
Okay.
I can't see your face, though.
You can.
Can you see mine?
I do. I see you perfectly. Yes.
Come and say hello.
Say hello.
This is another one of our nurses.
Hi, everyone. Hi.
This is Adina.
Hi.
We have 3 nurses total here.
Oh, wow. You know, you really take safety into highest regard. There are 3 nurses in Camp Sternberg. That's amazing. Well, you really do have, a really, really large amount of people. Like how many campers do you have?
So we have, remember that camp nurses are not just responsible for campers, we're also responsible for staff. Right. So it's about a little under 1,500 people total here.
Wow. Oh my goodness. That's a lot of people. So, and so you were saying that there were some emergencies already today. Is that standard practice?
Yes, it is. And you just quite never know when it's going to happen. So thank God everyone's okay. Everyone's alive. Everyone's limbs are on. No one's limbs fell off. So we're all good. And Aviva's here too.
All right. Hi, Aviva.
Hey, how are you? I look disgusting. Honey got dressed up for you?
No, I didn't.
Oh, you guys look great. Okay.
I feel bad because we can't see you.
You don't see me at all?
No, it's weird. I'm wondering, I may drop off for a second. Just hang on. I'm sorry if I drop off, but I'm just trying something.
Okay. Let's see the connection. Hopefully the connection is going to go well, considering that okay, hold on. Let's try this again. Okay. Yay! All right. Okay. Technology at its finest. All right. Hello. How are you? I'm so glad to be able to introduce myself and to see you guys tonight. So today was a very really complicated day with a lot of emergencies, it sounds like, but it sounds like that's par for the course. And I think that number one, for parents that are watching tonight, it's good to know that these experts over here deal with emergency all the time. And you see, they're not even breaking a sweat. It's all par for the course. It's kind of like just the natural progression of what happens in camp. And we were saying that there are so many campers and staff members that you're in charge of, but yet, you know, smiling, coming together, and really, you know, rest assured that you guys have it all under control, and that it is, you know, it's something that is just kind of the natural way that happens when it comes to camp. But there really aren't things that are out of the realm of ordinary, because you've been there, you've done that, you've seen it all. And so for parents that are so far away, maybe it would be good first to just give a little bit of a background as to your expertise and really like what it's like to be in charge of the health and well-being in Camp Sternberg.
Okay, so I'll start. I am actually during the year labor and delivery nurse, and my camp is primarily that. But in the summertime, I just started my camp last summer. But in the summertime, now that I'm able to be in camp, thank God with COVID we're doing better. I am here, and I'm going to be doing all about camp this whole entire month. And this would have been my 5th summer, but it is my 4th summer because of COVID as a camp nurse. Yes, because last year I missed camp. And I started off at another camp, and now I'm here, and I'm Sternberg camp nurse for life. I love it. I have this amazing head nurse here, Aviva. It's great not to have the entire everything on my shoulders. I'm just like a backup dancer for her. She gets to do she gets all the blame, you know? So, and I love camp. I've loved camp my whole life, and I'm so grateful that I'm able to come to camp as, you know, doing my profession. So that's great. Aviva's got a little bit more camp experience than I do, so I'll let her tell you about her.
So first of all, I grew up in Camp Sternberg. I spent 9 years here as a child.
Wow.
I was here from when I was 8 until 16, and Sternberg was in my blood. I became a nurse in 2009. I met the Greenwalds at a function 2 weeks before camp started, and as a joke said to them, "Are you looking for a camp nurse?" Mrs. Greenwald, who's very theatrical, jumped on me and said, "Yes!" I was like, "It's 2 weeks before camp starts. Like, you really don't have a nurse?" She said, "Well, one of the nurses just backed out." I said, "Well, I didn't take my boards yet. I'm taking my boards on June 30th. When does camp start?" She said, "June 28th. When can you come to camp?" I said, "I don't know, July 1st. So I went home, I looked at my husband, I said, "What did I just do?" He's like, "Since I met you, you've been talking about Sternberg. Since you became a nurse, you said you want to be a camp nurse. Now you have the opportunity to be a camp nurse in Sternberg and you're going to pass it up. We're going to do it." At that point, my kids were little. I had a 5-year-old and a 2-year-old. So I called it an insurance policy for when my kids got big. And I've been here ever since. I came up on July 1st, 2009. That year was swine flu. We had 183 cases in 3 weeks. I was 7 months pregnant and worked like a dog. And that really, it was not my worst summer. And I've had worse experiences.
I think it's important to know with
parents, did you just hear that? Did everyone just hear that? 183 cases of the swine flu, and that wasn't the hardest summer, and you guys have seen worse. Like, this really, rest assured, been there, done that, and that there's a level of just desensitization, as we call it, that like just happens. You guys, like, you are really prepared for everything and anything.
Yeah, and I think that it's important to know in camp, the environment in camp is that everyone is living on top of each other. They're all sleeping in close quarters. They're all eating in close quarters. They're all dancing in close quarters. And that really is a breeding ground for infection. Like even, you know, I would say every single, that's why there's the meningococcal vaccine that is typically recommended when people are in dorm settings. But, you know, children should get them younger, this vaccine, if they're going to be going to camp and they're going to be living in close quarters, because this virus is just a very contagious one. But in general, just small things like the kids start walking in with sore throats, and the first week of camp, we got a few trickle in. And then by the end of camp, everyone's got that sore throat. It's not a strep or anything like that. It's just the nasal congestion. It's when you're living in close quarters, kids just naturally will catch infections sooner. You know, 2 summers ago, we had a massive impetigo outbreak. And I think we did a great job really identifying it and putting it under control. But a lot of kids will get it because impetigo is a skin infection that is transferred through contact. So the kids are playing with each other. The kids are going on the toilet. The next kid that goes on the toilet, they're going to get it, you know? So I do think it's helpful for parents to understand that when they're sending their kid, you know, these are not, sometimes parents get upset. How can my child get an infection? But really, this is just a natural consequence of living in that kind of environment for a child.
Right. And I think that, so a few things. So when a child does get sick, for those, a lot of parents that I've been working with, it's like they're sending off their child for the first time to sleepaway camp. So it is not a horrible thing. Let's just kind of walk parents through the process. So your child comes with symptoms and doesn't feel well and comes to these two lovely, amazingly, clean and bright women and comes and says, I'm not feeling well. And so please just kind of walk through what the steps would be so that they understand that it's okay, and that it's not something that they can't conceptualize.
So firstly, and Aviva, you'll take over from here, but firstly, I want to tell you that any child that comes in, we take seriously. Like, we see them, and kids will walk in, can I just have a Tylenol? Can I just have an Advil? No. We actually check their portal. We want to make sure that their physician's form is filled out and uploaded correctly. And unfortunately, too many children don't have that, an updated form, because we want to make sure they don't have any allergies. We want to make sure, do they have any pre-existing conditions that might be exacerbating, that will tell us a little bit more about the child. We also record everything. When we see a child, we record it all in our log, in our treatment log, so that we can keep track, because obviously we're seeing hundreds of kids every day. We're not going to be able to remember each child individually, and there are a few nurses. So if a parent calls and says, I'd like to know how my child is doing, what's going on, we'll have that log already in there.
Continuity of care.
Right. It's the continuity of care where, where we'll know what's going on, even if we were not the nurse that treated the child initially. Or if we're treating the child and we're seeing them for the first time, but they've been to the infirmary several times already for the same condition, we can see, like, what's been the progression. Is the child healing? Is the child getting worse? And, for small things, we won't necessarily call a parent and worry them. Like, if a child just has a sore throat, we'll check them if they have a temperature, if they have swollen glands, like, we'll do a full-on check. If they just have a sore throat and a little bit of nasal congestion, if their forms are filled out correctly and they have permission to get medications, we'll do that and send them off on their merry way. So we're not calling for every little tiny thing. We're calling for more for the serious things that maybe would warrant a visit outside of the outside of the infirmary, that maybe would warrant prescription medication,
admissions.
Right, or an admission to the infirmary.
Right.
That's always a call. That's an automatic call to the parent.
Right.
If the child,
or what about if it's just a child like wants you to call their parents? You know what I mean? Like, then you won't. Good.
We don't call parents when a child says, "Can you call home?"
When they're sick, like, when you've given them, whatever, they have some sort of symptom, you're still not going to.
So
you have your protocol.
If it's just for a cold or for a cough
Good.
Or for a headache or for cramps, we're not calling parents for that. And also in Camp Sternberg specifically, I don't know how all camps work, because I've been here this is my 13th summer working as a nurse here. In Camp Sternberg specifically, they have a policy about children not calling home on a whole. So we only allow children to speak to their parents when they are admitted because they have a fever or they have strep or something where they're contagious and they're going to sleep here for the night, or if they have an injury and they have to go out, like they have to go for x-rays or they have to go to the podiatrist for their toe, for their ingrown toenail or something like that, when they're going to see a specialist, if they're going to the orthodontist because their braces broke. So for that, we do allow them to speak to their parents. But also the other thing that we have found, especially like if we admit a kid at night, I'll call the parents and I'll say, it's probably better if you wait till the morning. At night, kids get way more homesick than during the day. And when they're sick and it's night and they're homesick, it makes them feel much worse.
Right.
So it's just worth it to wait until the morning and let them speak to the parents in the morning.
Got it. Right. Okay. So, what I oftentimes tell parents, and this is kind of just to reiterate what you're saying, is that there are really the ABCDs of what's going to happen when your child is not feeling well or sick in the infirmary, and what your responsibility is. So A is that you guys are the authority. You're going to solve the problem, or you're going to kind of siphon them off to whomever it is that they're going to be. B is that you're going to make them feel better by giving them the belief you're going to get better. You're giving them that emotional piece. And C is the comfort. And either that means that you guys will do it, or you'll send the counselor in, and that, whoever it is who's going to be able to give them the comfort, don't worry, they're going to get the comfort. And D is the distraction. There's going to be nice distraction. They'll have what they need. They'll be able to read their book, or, kind of have, whatever it is.
We have a DVD player.
See, there
We've got arts and crafts projects.
There you go. So everything, like the ABCDs, are covered, because I think that parents feeling so far away really need that reassurance, even more sometimes than the kids do, because the kids are, now feeling, well, they're dealing with, they see firsthand the loving care that you guys are giving. But parents, they want to know that their ABCDs are really accomplished. And it sounds to me like that's part of your protocol. And so much so that you're not even like, giving some of the responsibility back over to the parents. You're saying, no, we got it. You don't need to make the call. Like, we've got it. We know what to do. We can do it for you, and we can make you feel good. And I think that that's really important, that you're not passing along the baton because it's not needed. You guys are really full-fledged, like dealing with it for, in the moment with yourselves. And I think that's really reassuring for kids to know. And
I'll give you an example also, like as far as like admissions, like Hani said, when we admit a patient, we always call a parent. But Motzei Shabbos, depending on like the timing, like because Shabbos is over so late in New York, and we don't make Havdalah right away, and the infirmary is not always open right away. If we have a girl walk in at 11:30 at night on a Motzei Shabbos with fever, we really think about, like, do we want to call a parent at 11:30 at night and worry them? We're going to admit her. We're going to take care of her. And then we really have to think, like, where does this parent live? How many kids do they have at home? Do they have any kids at home? If they don't have kids at home and they're older, like this is their youngest child in camp, they might be sleeping. If they have a bunch of kids and this is their oldest child, then probability is at 11:30 at night on a Motzei Shabbos, they are up, and we will call them. It's not that we don't call a parent. It's that we have to take it with chachma. If it's an emergency in the middle of the night, if a kid is having an asthma attack and they have to go to the hospital in the middle of the night, we will wake them. We will. But we also have to use chachma.
It's like that critical decision making where we really take a bigger picture into consideration. And like Aviva said, sometimes we like to treat the child first and then call the parent and let the parent know that the child is okay. For example, we have a child that walks in with wheezing. It's not like she's not imminently, it's not an emergency, but she's experiencing some wheezing. She maybe has a history of allergies. She maybe has an inhaler. We give her a nebulizer treatment. The wheezing goes away. And then we'll call the parent and say, hey, we wanted to let you know your child came in. She was wheezing. We gave her the medication. She's doing great now. She's fine. She's able to go back to her bunk. So we notify the parent, but at the same time, they're just reassured that everything is resolved, and they don't have that like just pit in their stomach, like what's going on those 15, 20 minutes while the child's getting the nebulizer treatment.
Also, we do have, like when we call the parents, sometimes we'll dafka go into the other room and not call in front of the child because we want to give them information. We don't want to make the child more anxious. We want to be able, like we had an injury on Friday and I cleaned up the girl, took care of her. Then I went into the other room, called the parents, and then I had her talk to her mother. Like there's a progression of how we do it.
Right. A sensitivity. That reminds me so much of, one of the big things that I do is, there are 3 different sizes to a problem. There's a small problem, a middle-sized problem, and a large problem. A small problem is you handle it by yourself. And I imagine that also goes like a kid or the counselor. They handle what they have to do. If a kid just falls, that's not they don't necessarily need to come to the infirmary. Right. And similarly, there's a lot that a kid could do or the counselor could do without you guys. But then once that we cross that threshold and it becomes a little bit more intense, then they come into you, and it's like there's some things that you guys can do, and there's some things that you send out, and then becomes a large problem where it's like, no, you're sending to an expert, or we also need to involve the parent. You couldn't calm the child down. It's kind of like you take that approach where at every level to see, do I have to go on? Do I have to do more? Or, get more help, or can I just handle and kind of like deal with it in that moment? And I think that really allows for the most comprehensive type of treatment to happen, because you guys know where you need to be and where, like, you keep on passing it along. So, to have other people get involved. And I imagine, being that you deliver babies, that, there's a certain level of like emergency, and then there's delivering a baby. It's like everything kind of is a lot less intense.
Well, we call it triage.
Okay.
We call it triage, which means that we can have a waiting room full of kids that need to be seen, for maybe a cot or a sunburn, and then you have a kid that comes in wheezing and that is having difficulty breathing, right? So that's the kid that's going to be seen. You have a kid that says they bumped their finger, but it's after infirmary hours and they're just chatting and joking with friends. We know that that's something that can wait until the morning. And unfortunately, sometimes we'll have parents get upset that they can misunderstand it. The kid will say, "Well, I came to the infirmary and they turned me away and they didn't see me." So like you said, it's kind of like that. We're looking at the child who's jumping and playing and so happy. Power come during clinic hours when we have, all the staff. We can actually give you a thorough assessment and really give you the treatment that you need. But right now we're closing up. So,
now that's when it's like clear cut. Because it's on the surface, you can see it, you hear the wheezing or you see the cut. Now let's just talk a little bit, because, sometimes kids come in and they have a stomach ache, right? But it is more kind of connected to something that I see very often, which would be homesick or needing that TLC. And like, how are you guys able to, kind of see it, or what do you do about it when it's not as clear cut that there's an actual physical ailment going on?
Can I say my conversation I had on Friday night?
Yeah.
So I had a girl come in on Friday night and she's complaining she has a stomach ache. Okay, a stomach ache can be a lot of things. This is what I start with always with a stomach ache. A stomach ache can be a lot of things. Can we try to be a little bit more specific? Because I want to be able to help you the right way. And then I go through all the different possibilities. So constipation. When was the last time you pooped? Are you pooping normally? It could be your bladder. You might have a UTI. When was the last time you peed? Are you peeing normally? Are you drinking enough? Are you dehydrated? Dehydration can also, not having to do with a UTI, dehydration can also cause stomach aches.
The camp food.
Are you eating only oily food? Are you eating, there's a low fiber and high carb diet. Is this what you normally eat? And I go through a bunch of different possibilities with them. Is it cramps? Girls will come in and they say, I need Advil for my stomach ache. Well, we don't give Advil for stomach aches. Advil's actually bad for stomach aches, but if you have cramps, then I can give you Advil. So like I try to destigmatize periods. Like we can talk. We're big girls. We're all girls.
Right.
We can say the word period. Right?
We actually just got someone who came in and got her first period in camp. We get plenty of those too. And we try to make a big deal of it and celebrate and tell her it's a wonderful thing.
So I go through all these different possibilities and she keeps saying no to me. And I'm not just giving her suggestion, like I'm asking her constipation. Okay, when was the last time you pooped? And dehydration, how much did you drink today? And so I go through a lot of different scenarios with her and she keeps saying no, 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 no. And I try to leave period cramps to the end so that they're more comfortable with me at that point. And again, she says no. And then I said to her, is this your first year in camp? And she said, yes. And I said, well, I've been here for a very long time and I've been treating patients here for a long time. And one of the things that I have seen is that sometimes homesickness can actually manifest itself as a stomach ache. Is it possible that you're homesick? And she said, yes.
And a lot of times they'll start crying.
Right. And then all of a sudden it was like, oh, okay, I'm just homesick. I'm like, the problem is that they don't realize, even though they identify that they're having a stomach ache and they identify that they're homesick, they don't know that the two go together. So now I just named it for them. Now it's normal that she has a stomach ache. So now I say, okay, so we're going to settle your stomach with some tea and crackers.
And TLC. But I think it's important what really, like, we've had a lot of the stomach aches recently because we just started camp and Shabbos presents another new challenge. Yes. So we just had our first Shabbos. But, and I tell the child, I believe you that you have a stomach ache. Like, I feel like sometimes they feel discounted that we just write it up. Oh, you're homesick, go away. I say, I believe you, but like Aviva said, how are we going to treat that stomach ache? What's the source? If you're homesick, there's a different way to treat it than if you have period cramps.
Right. Oh, interesting. That's, wow. I think that, so a few things. I think it's so special that you'll go through every single step and you'll ask, and like you're really legitimizing and really like saying, okay, so you're saying that you have a stomach ache. Now I'm gonna like really make it so that I believe you, and here's like all the questions. And I think that that goes a long way. You know, my belief that when someone needs to be healed from an emotional kind of, you know, sickness, then, you know, the mnemonic is heal. So H is the happy factor, right? Like, let's see what we could do to kind of make them feel like they could be happy again. The E is to, like what you said, everyone feels that way sometimes, and it's good for them to hear that they really, like, everyone feels that way. A is allowing them to speak it over with you or with another person is really important to kind of bringing down the feeling. And finally, L is like letting it go and saying, okay, we're going to monitor it. Like, okay, so, you know, today you're this way. Let's see, you know, kind of go have fun. Let's see what you have to look forward to tomorrow. And let's see if, like, you know, check back in with me tomorrow to see, like, is it just as strong? Did the stomach ache go down a little? You know, all of that. But, you know, but you guys being like the kingpin for it, because like you said, you're making that connection between the, you know, the emotional piece and, you know, and the physical piece. And it really, like, it comes out like they didn't make it up. Like they do, they have that stomach. It's either the stomach or the throat or the head or the joints. Like that's where homesick seems to find itself, you know?
Yeah, and then we'll refer out because we have a team. We're medical, but obviously it's our job to pinpoint the emotional, psychological things. And we have a team. We have the heads of the different divisions. We actually have a camp psychologist also, and a full-time camp psychologist too. And we'll get them involved. And a lot of times this treatment happens in the infirmary just because it's a private, quiet space.
Right. And I think that because there's something that is like the physical seems to be a little bit easier for kids to kind of like identify and be okay with than just the emotional. So I think that, you know, that you guys really are like the gatekeepers to all of the treatments because they feel most comfortable. Like when you're asking them about constipation, somehow it just brings it all down. Then, you know, then let's just talk about your feelings, right? I think that that definitely makes a difference.
Yeah,
absolutely. Yeah. And, you know, we just had this, I had a child that came in, kept complaining about a headache, no pain medication was working, nothing. And finally, by the third time I sat her down, tried to get like a little bit of what's going on. And she spilled out this like crazy story of so much trauma that she went through in her young, little, short life. And we had a conversation about it. And I told her I was going to refer her out to, you know, the division heads, whoever was responsible for her to really help address it more, the camp psychologist. And then she just like trots out of the room. This is the third time she was there telling us that she still had a headache and that nothing worked. And as she was going out, I said to her, I said, did your headache go away? She's like, and then she went.
Wow.
So yeah.
Wow, but you know how gratifying you guys get, like all this good stuff. I mean, yes, it's, you know, the highs and lows, but really you see how much it affects change and it really makes a difference. That's terrific. Wow. That's so special.
Part of it for me also being here for so many years, my daughter is 17 now, so she's JC age. And I've seen a lot of girls that are JCs here. I know them. They're here year after year after year. Some of these girls, like I've been here, like I said, it's my 13th summer here. Some of these girls have been here 6 years, 7 years, and I've literally seen them grow up. And I've been through like, you know, so many different things with them. I've been through, you know, one girl had strep 1 year and stayed here for 3 days and she became my friend. And one girl had ADHD, so she came to the med window every day for her pills. And one girl had chronic constipation, so we solved that problem. You know, like, and you go through so many things with these girls, and then you get to see them all grown up, and they're staff now, and they're giving back. And like, it's really, that's one of the things I love about camp nursing, that it's not just being a nurse. We're in camp, and we're creating relationships, and we're creating foundations. And it's just an amazing experience. You know, I worked in a school this year. School nursing is nothing like camp nursing. In school, you're there for a short amount of time. They come, they leave, they go home. Here, they live here. And when I'm not working, I go to night activity. And, you know, on Shabbos afternoon, I try to go to the kumsitzes. And, you know, like, you get that full experience and you get to make relationships with these girls and to watch them grow. And it's a really beautiful thing.
Wow.
Yeah.
That's so nice. And it's really coming from your heart. I mean, you were a camper and
Yeah.
then a staff member, and now even with your free time, you're continuing to be like, part of the camp. Is that the feel that you get from Camp Sternberg? I mean, you can't let, it's just that loving kind of place.
Yeah, and I have to say, I'm one of the very few administrative staff that did not go to Sternberg.
Okay.
As a kid. I wish I would have gone, and like they will know, like, oh yeah, there's like 2 or 3 of you, that didn't go here. Like they all know each other otherwise. Even the people that come in where they've never been in an administrative staff role, but they've been in Sternberg like 15 years, so our new nurse. So, everyone's like, oh, you're new here. And she says, well, I'm not new to Sternberg, and she looks at me like she's new, even though this is not my first summer. But, it really is. The people here return. It's just an incredible, amazing camp. I've never seen it. I've been to other camps, and it's really amazing. The whole, like Aviva said, just seeing everyone grow.
Right. So it's an environment that's really inclusive of everyone. And I think that kind of brings us to something that you were telling me about, this inclusive idea that is happening in Camp Sternberg. Can you talk about that? Because I'd love to understand that.
So I just wanted to say, because I messaged this to Kasia about how Camp Sternberg is inclusive, where they make accommodations for disabled children. So somebody who has a disability who needs to be in a wheelchair, we have several children that are going to be coming, that come to camp in a wheelchair, and the camp accommodates them. We have children that come in, several children who have alopecia. They have no hair on their head. They have no eyelashes. They have no eyebrows. Several. And they come together and they keep on coming, more like friends of theirs, because they know that Sternberg, sorry, that's the phone ringing, because they know how inclusive camp is and how it's encouraged. Like, let's celebrate the diversity. Not everyone is going to look like your standard cookie cutter. And that also includes children who may have struggles and challenges. Some camps are, I think, very, they filter, they only accept certain things, but like I said, Sternberg in general reaches out, and they want to help all children. And some children come from disadvantaged situations in their lives. Unfortunately, they've been through a lot of hardship, including financial hardship, and they can't necessarily afford to go to camp. And that was, Aviva's not here, but she'll come back in a few minutes. That's why there is now a fundraiser going on. It's called Hike to Help. In order to enable these children to come, and I hear this and I see children, like I just told you about this girl who came in earlier, 3 times in one day. And then suddenly when we talked about everything and I said, listen, you got to talk more about this to division heads, to safe people, she walked out like she had no more headache. And they really strive to work with the girls that come who have difficulties in their lives, because some of these girls say that I even see some of the division heads, the staff, their hearts are breaking that the child is going home now, because she's going to have a really difficult home situation, a really difficult 10 months, and she lives to come to camp. She lives to come to camp to get the emotional, the growth, the people caring about her so much. Like Aviva said, the same people returning year after year. And like Aviva said, some of these girls, a lot of them, they grow up to become staff members that give back and that do the same for other kids who are coming from those situations. And they understand it. They've been through it themselves. So they have that special compassion and empathy that someone who may not have experienced that may not have that deep of an understanding.
Wow, that is beautiful. So Aviva, what exactly are you doing? You're raising money to enable other children to be able to come to camp. Like it's a fundraiser to have people. It's like kind of like a sponsorship. That is so beautiful.
Rabbi Greenwald, if anybody knows from years back, Sternberg was known as a Federation camp, which was actually, it was not a Federation camp. Sternberg was a non-for-profit camp, and the Federation did give a huge amount towards scholarships. Rabbi Greenwald himself also used to go around and raise money for the girls to come. One of the reasons that it became a for-profit from a non-for-profit was actually because he raised so much money and allowed so many girls to come that he actually had nothing left. It was kind of sad. Rabbi Greenwald stayed the director after it became a for-profit camp, and he stayed collecting scholarship money until he died. And after he died, there were quite a few of us in administrative staff who had been here for a long time, who had also previously come to campus campers. And we really wanted to keep his memory alive and going. And we wanted to set up something, Lilu Nishmaso, that was perfect for him.
Beautiful.
We felt that a scholarship fund was really the right place for that. And we've successfully raised money over the last, this is the 5th summer that we're having Hike to Help. We changed it this year. The last 4 years that we did it, we did a bike ride from camp to Indian Cliffs. And then we hiked Indian Cliffs, which is a famous pioneer hike that we do. And then we canoed down the Delaware. So not everybody did the biking portion, but everybody did the hiking and the canoeing. Just because we've done it a few years in a row and we wanted to change it up. So this year we're doing a different hike, and we're also doing something called caving, which is also a pioneer activity every summer. The older girls go, older pioneers, sorry, I should use that term.
That's the division.
It's the girls that are going into
That's the one where they live in the wilderness.
Right, so actually
Yes,
the older
I
pioneers.
I have patients who have done that. That's amazing.
The older pioneers, they're actually referred to as the T's, and the T's, they live in tents, and the tents actually was my idea when I was in camp in 1990. Rabbi Greenwald called me over with 2 friends who had both been in camp for a while. He called us over by our last names. He always did. Actually, when I came back to camp as a nurse, he called me Meyerfeld, even though my last name is Gluck, because he knew me as Meyerfeld. And he said, if you could create any program that you want in camp, what would it be? And I said, I want to live in a tent. And then in November, I got an application for a new program where we were living in tents.
Wow.
And like, he listened to people. He just, you know, Camp Simcha started in Camp Sternberg. The first few summers that Camp Simcha was opened, it was in Camp Sternberg. It was camp after camp. Camp Migdal, which is here, is very, did you talk about that? They're very low functioning camp. They're campers that even Camp Hask won't take. And then we have Camp Kesher, which is like medium functioning. Girls who are verbal, walk around. Some of them, like it's a 2-to-1 instead of a, you know, like it's 2 campers, 1 counselor, not 1-to-1.
And they are integrated within the camp.
So which is something that is very near and dear to my heart. I've started several school situations, inclusive classrooms and in regular classrooms, because I really do believe that environment allows for the benefit for the children who are there, and of course the benefit of the people that are around the more typical children, because we all benefit from diversity, we all benefit from inclusion, we all benefit from empowering children to be whoever they're going to be, because everyone is special in their own way. And that was actually one of, you know, that I worked for, you know, in my practice for the last 20 years, almost, to, you know, really to maximize that understanding. And Gobi Society, what I have now on the, you know, is really one that not everybody can afford, you know, psychological treatment, and some people need it in smaller doses and larger doses, but really it's a place, it's a society where everyone can kind of benefit without the, you know, necessarily all of the same financial constraints or the same emotional wherewithal that you have to give, because I really do believe, like you were saying, that there's so much that everyone should be able to benefit from everything, and there shouldn't be financial constraints and emotional constraints. They're all different things. So it is so beautiful to have this idea that a camp has really, that there's an area for all different types of functioning, and then everyone should really be able to benefit. And if you can't afford it, then it's a beautiful, beautiful concept to be able to, you know, that Eloi Nishmas, Rabbi Greenwald, to be able to say, you know, that there's continuous fundraising so that everyone gets a chance to have a good time in camp, especially those families who really need it. Those are the families where the parents could also use a little bit of an extra summer, where they have a little bit menucha, where they have, you know, the idea that their kids are taken care of, because the rest of the year is a very hard one. And so you're doing a service to them, in addition to doing a service to the children who could so benefit from being able to have the happy times and the smiles that camp provides. So
And
that
I
is
want to,
beautiful.
add this camp in particular is not like the children who have financial constraints who come here. It doesn't turn into the haves and the have-nots in terms of the bunks. You have girls, friends. You have girls sleeping, the rich, the poor, all together. They're all integrated. Like you won't necessarily know it from looking at it. There's not this like division of, oh, those are the poor girls that can't afford to come to camp. Like, and that is amazing. I've never seen the integration, the level of integration that happens here. Like the girls are side by side. You know, you'll meet someone, you'll know someone who's super affluent, and they're friends with those other girls, and it doesn't matter really.
Right. And there's a certain, I don't think it's a very materialistic, camp in general. No, I think that's, that's what I've been told. And I think that's very nice. It's kind of like, that's not what's important. That's not what brings the fun. What brings the fun is, the environment and the happiness and the pro-social and the friendships and all of that. And it sounds to me like you must be doing something right, because everyone keeps on staying, and then they come back as staff members, like you were saying. If everyone's keeps staying in the camp, there's something that's very special and a real core that allows for continuous participation. And I think that's such a beautiful thing.
I just wanted to share something quickly. There was a camper that came to camp one summer a few years ago. She had a medical condition, and she was supposed to come to us for the first half and then stay in a day camp for the second half. And right before she came to camp, she was diagnosed with something, and the mother called me up in a panic, can she come to camp? And as far as like for her safety, the only thing that was like medically that I needed to take care of, she wasn't even on any medication. She needed to have labs drawn to make sure that everything was okay. And I said, yeah, we can do that in camp. We have a lab that we work with, and the nurses here draw blood, and we can send it out, and don't worry about it. And I spoke to her doctor frequently, and I spoke to the mother frequently, and the condition ended up being prolonged. And last minute, the day camp that she was supposed to go to second half pulled out and said she can't come to the day camp. And the mother's like, I don't get it. She's in sleepaway camp. They're happy. Like here, she's just going to come for a few hours a day. Like, she's not living by you. Why can't? No, they wouldn't have her. So she ended up coming for a second half also. She stayed for the whole summer. And at one point, she went home in between to, we have trip change, and sometimes trip change is 2 days. So the girls go home. So she went home in between by trip change. And when she came back, the mother came to speak to the program director. And she came over, and the conversation started with, I was unpacking my daughter's bag, and everything was filthy. So the program director was waiting for like the shoe to drop, that she was going to be mad and whatever. She's like, I can't tell you how much I appreciate seeing filthy clothing, because it means that my daughter was happy and she was excited. And she said to me, Mommy, you don't have to wash everything, because I'm going right back to camp and it's just going to get dirty all over again. And the mother started crying, and this program director was so overwhelmed. But really, like, we have this attitude here, as long as it's safe to have them in camp, then we can handle anything. We have
right, and you take the right safety measures. We're
100%.
Talking like like what we started with. It's I think that you're professional. You have a great approach, and so when there's safety, then and only then can we have the fun and can we have all the excitement. And but safety always comes first, and I think that that's very reassuring. That that's really the protocol. But then once safety is in gear, then it's fun, a lot of fun. And there's a lot of dirt, and there's a lot of tents, and there's a lot of mud and a lot of germs. But that's part of the fun, and I don't think that one doesn't take away from the other.
And I just want to also emphasize the parents who are sending their children, who have not sent them yet, maybe second half, please be open about your children's both medical and psychological, emotional, mental conditions. It is so important. Unfortunately, we get so many surprises, and there are so many things that we can do in order to mitigate embarrassment, in order to get the child the treatment that they need in a more timely fashion, in order to be able to diagnose something more specifically, because we'll have the information. And some parents won't say even important things like a diabetic child, and they will not disclose that to the camp because they're afraid the camp will not accept the child.
Oh, or they tell their children, like, don't worry, you just take your pills on the side, don't give them into, like, why would you do that? That is just, that's a recipe for disaster. There's, you know, there is a level, listen, that resonates with me. I'm a psychologist. I take a very detailed history. Oftentimes parents don't say, you know, that takes a relationship and a lot of building. And then a couple of weeks in, they'll be like, by the way, do you know that, you know, the mental health history, I just want you to know there's a genetic predisposition to something in the family. It would have been helpful to know it earlier on. And I do understand that there's a level of reserve, but it's not safe. You guys need to have the right information in order to put together the treatment for each individual child's safety in your camp. And that goes without saying, even though it's uncomfortable. Now, you're bound by confidentiality, right? And that
very
right. And it, you know, you're in your eyes only, not even some of the other members in camp. You know, there wouldn't be a counselor or a head counselor or even office staff. Like, this is confidential. This is something that you know, this is part of your, you know, your training.
Yeah, and counselors will be told, for example, that their child, that some of a camper of theirs might be on medications, but they're not going to be told what the medications are.
Okay, good.
Exactly. And like even ADHD, right? So children can take medications during the school year, right, to help them learn, to help them sit and everything. And parents just assume, oh, okay, I'm not going to tell anyone my child has ADHD. I'm not going to send any medications with my child because why should they take medications? They're not in the school environment. Meanwhile, you know what? We'll work with it. Maybe the child will not need medications in camp, but there are still routines that they have to follow. They have to keep their area clean. They have social interactions that we want to put their best foot forward. You know, they have places to be at specific times, and children with ADHD can have a hard time doing all of that. So a lot of times it's really to the child's benefit to continue the medication so that they get every last amazing, and this is just one example, but they get everything out of camp that they could on the most amazing way, you know, so that they can be favorable to their peers, so that they can make friends.
Is their time. This is their social and emotional functioning. This is when it's at their best, right? You know, you want them to be at their best, to be able to make those friends and have you're living with people, you know, every day, all day. This is what, you know, it's all on. There's no off.
And then sometimes we'll have a child that misbehaves and nobody can get down to the bottom of it, and the poor child gets, you know, disciplined and told that they have to do this and that, and we're like, kind of like, does the child belong at camp? And then boom, the child has ADHD, the child is on medications during the year for ADHD, and that all could have been fixed so quickly, and the child wouldn't have had to suffer until we figured it out.
Right. So partnership with parents is really important. Open door policy, open and honesty, to really maximize that the child should have the best time. And really, you know, I think that goes a long way, because otherwise you don't know. And if you don't know, then it's just about guessing, and that doesn't, you know, shooting from the hip doesn't really work. 100%. But again, you know, there's confidentiality. There's only whoever needs to know how much they need to know. And you really take a sensitive approach with that. You know, it sounds to me like every child is like your own child. And so the decisions that you're making for them are the ones that you would make for your own, in terms of the privacy, in terms of trying to take care, in terms of wanting the best for them. And that really is, you know, that's safety. That's exactly what a parent should feel comfortable and confident with when sending their child off to camp.
Yeah, definitely.
Because, you know, it's definitely, you know, it's a partnership, and it's weeks. It's not just, you know, a day. It's a long amounts of time. And I think that, you know, that just talking about it, I imagine when people are going to listen and they're hearing this, their own anxiety is kind of like going down. Okay, you know, there's a method, and there are all these rules, and there's also my participation as a parent. What can I do? And what my child could do. My child also has their part. Everyone working together really maximizes on safety in camp. And just before we end, I'm going to get the link from you, and we're going to continue to promote. How long is this?
Hike to Help is going to happen on August 4th, Emeretz Hashem.
Okay. So we have until August 4th.
Yeah.
Okay. Well, Hatzlacha, and really,
thank you.
Best of luck. You guys do a tremendous job.
And so do you.
Yeah, thank you.
And
You know,
send your
together
kids
we
to
can
camp for
empower,
second
empower,
half.
empower. I'm sorry, what?
Send your kids to camp for second half.
Okay, send your kids to camp for second half. And empower, empower, empower children. Hatzlacha. Good luck to both of you. Thank you so much for joining.
Sure.
And we'll be in touch. All right.
Okay. Have a
Good
safe
night.
and healthy summer.
Thank
Bye.
you. Bye.